My name is Tiffany. I'm based in Austin, Texas. I'm 33 years old. I'm diagnosed with ovarian cancer, stage 3A. I love pole dancing, contortion, and I'm learning how to draw for fun, as well as watercolor in my free time. I was supposed to go travel abroad for a year in 2024. I was supposed to leave January, like the first weekend of January. So instead of, I didn't want to carry like a year's supply of birth control with me. So I decided to get an IUD. So we did like the normal stuff that you would do during the annual exam. She didn't find anything weird then. So there's that. So I got the IUD inserted like about 2 days after my appointment with her. And at first the IUD was fine. I mean, like it wasn't like too painful or anything. And then I had my strings checked a month later, and that was okay too. But I was bleeding a lot. About a week after it was inserted, I started bleeding like crazy. Like it was like I was soaking through a heavy pad for like every hour or so. And so they say it was normal, like when I called, and so I kind of just left it because it went away eventually. But for some reasons, like a couple weeks after the string check, I started bleeding a lot again, and I didn't really stop bleeding until they took it out. So that's why I called them to double check to make sure it was okay. So I remember I called them probably mid-December or so, to get it checked and to kind of ask them like, hey, like, can you do something about this? Because usually what happens is like you call them and they just tell you, oh, it's normal. It's an adjustment period for the IUD. You'll be okay. And I was kind of like, I'm leaving in a few weeks. Like, I need you to like make sure this is okay before I go abroad. So finally, like they got back to me and they're like, okay, we're gonna do an ultrasound to check. And so I went in. I remember going in, I was like, I'm pretty sure this IUD is misplaced. So, okay, big deal, whatever. Shouldn't be a big deal. So I went in, I was like, okay, cool, let's get this checked. And I remember, I remember she's like, the sonographer is like going through everything and all that stuff. And then like I looked at the screen and saw this like huge hole. Like I can't read the graphics, but I kind of saw her face and I was like, what is going on? Like, I'm pretty sure there's something more than just this IUD problem. But she's not able to tell me what's happening because I don't think she's allowed to by law. So I almost was able to talk to the doctor like right away, but then I actually had like a work meeting, so I had to like schedule it for like I think the next day or something. And so I was just like really anxious for like 24 hours or so. And then the next day I went in and the doctor was like, "Hey, look, we found a gigantic like cyst that we don't know what it is. I'm going to need to refer you to a gyno-oncologist." She didn't really say the word like cancer or anything. It was kind of like this giant mass, like we don't know what it is, but I mean, she's referring me to a gyno-oncologist. So of course I'm like, oh shit. And then she ran the this blood test for the tumor marker blood test, the CA-125. She ran it that same day, just so like we could get all the new doctor can get all the results and stuff. I went to the the new doctor, the oncologist, the gyno-oncologist, and she basically was like, "Oh, we need to get I need to see like an MRI, just because that's like standard." So I had to get that done the next week. And then after that, the follow-up appointment, she didn't really say it was cancer or anything. Actually, even though my blood work thing was like over the chart, my CA-125 was like 4,000 and the standard was like 35. So it was like crazy high. But different things can affect your CA-125, such as endometriosis, which I wasn't diagnosed with. All I knew was that I had PCOS. That was the only thing that I knew. Basically, she knew that she had to take out the ovary that was attached to the tumor. So that was kind of all we knew, but she said that, you know, she asked me, like, she told me that, like, hey, you know, like, if it's cancer, like, what are your thoughts about having kids? Because if it's cancer, usually they take everything out. And so she asked me that, and it took me like a few days to get back to her because it was just like so shocking to like think about. Like, but we ended up deciding that we would keep it, like keep like the other ovary in there, even if it's cancer, because we wanted to like preserve my fertility and see if maybe we could go through the IVF route. But going into surgery, I was mostly expecting that it would be borderline because the doctor was pretty like she thinks it's probably borderline because it's rare that someone in their 30s would have ovarian cancer. So it is pretty rare still, supposedly, but I mean, it could happen. Um, and so I went into surgery. I was just kind of like, it's probably borderline, which I think I forgot what she mentioned, but if she said that if it is borderline, then I probably wouldn't need chemo. It would just kind of be like debulking. It ended up not being borderline. What happened during surgery is that like she took the tumor out with the ovary, and she said the tumor was hard to take out. It was like it was the type where it wasn't like a solid tumor where like she could just pick it up with the robot and like take it away. It was the ones that like melted and like was like mushy and like gross sounding. And so the surgery took 5 hours, I believe, which was like way longer than expected. Because besides like taking it out, she also had to wait for biopsy to see if it's cancer, and then after it's cancerous, she does surgical staging. So she would swipe samples of different areas of my pelvis, like I think it was like bladder, bowels, my uterus, as well as the she took the omentum out for biopsy to see if there's any cancerous cells there. So I didn't really see her until the next day, and that's when she told me that, hey, it is cancer, but we don't know the staging. We just know that it's probably more than likely more than stage 2 based on what I saw in there, but not definitive. So then 2 weeks later, during my post-op appointment, I got the report. So the original report, it says there were cancer cells in the omentum, but I think because I want to say I'm not, so that's what it says there. So that would put me in stage 3A. But there was like another part of the report where they weren't exactly sure where the origin site is for the cancer. So they were suspecting that it's either primary ovarian or it possibly could be from the uterus or it's synchronized. After she told me about my diagnosis, she gave me a treatment plan. So I'm going to be having 3 rounds of chemo, surgery to take everything out, and then 3 rounds again. After like about a week after the report and discussing it with her, I started my IVF cycle. So I started freezing my embryos, and that wasn't that fun. It was a lot of injections, a lot of doctor's appointments, and a lot of going back and forth, kind of trying to get a discount. My insurance didn't cover the IVF cycle, so there were a bunch of, I had to look into different organizations that would provide discounts. The clinic did help, and there are discounts for cancer patients, I think in most clinics, at least mine did. And I was able to get help from Livestrong, and Heartbeat program with Walgreens. So the Heartbeat program, they basically gave me all the medication for free, which was really helpful because the medication itself, if you look it up, it's like $10,000. And I think we were fortunate in a sense because I know a lot of women, they have to go through multiple cycles to really get like freeze like 1 or 2 embryos. But we were lucky in a sense that, well, we only had one shot, it's just one cycle before chemo started. But we were able to freeze eight embryos, which was amazing. So I'm really happy that we got that done. And then right after, like a week after IVF, I started chemotherapy. This is a little bit morbid in a way of how I kind of processed it. It was more like, okay, well, if I, passed away in 2 years, I felt like at least I left something for him to decide on. Like, at least I left like a part of me there for him. Like, ultimately, like by then, I mean, he might or might not use the embryos. I have no idea what would happen. I hope he does. But that was kind of like my, like, I'm leaving something for you, so I'm gonna go through this even if it sucked. So the IVF process, so the first appointment was kind of just discussing the different options. So I had the option of just freezing the eggs or freezing embryos, but you still have to go through the IVF process. It essentially means they're just taking the eggs out. The embryo part comes later. So during the process, basically, they would monitor your follicles to see like how it's growing. And before they start, usually they want you to start, I think, I want to say like day one or two of your period. I didn't really have, I was like on a timeline, so it really didn't pertain to me as much, but I also luckily had my period the first day I saw her, so it kind of worked out in that sense. So the first appointment, she would check to see like how many like follicle reserve you have. So like how many eggs are like already kind of there. But I guess in a way it was fortunate. I had PCOS, so I had extra eggs. So apparently, like if you have PCOS, it's actually better for the process because you have more eggs. So once she thinks you're ready, you will start doing your injections. So the first few days of injections, I did two medications. So these injections are done sub like under the skin. So I would do it on my abdomen. And so the first injection was just so scary because you don't have to, I guess your spouse or someone could help you, but I just did it on my own. And so the medication kind of helps grow the follicles. So it helps to grow like the whatever amount of eggs you have. So in my example, I think I only had one ovary to do this. So I think for others, they might have two. So for my one ovary, I think she saw like 18 or something on there already. So they're trying to grow everything at the same time, essentially, with the medication. So the chemo regimen I'm on, it's carboplatin and Taxol. So it's two chemo drugs. So in terms of side effects, I think the major one is the hair loss, and that pretty much happened after cycle one and kind of throughout cycle two as well. But I think after cycle one, I was just so anxious. I just like was like, oh, I'm gonna shave it off anyways, just get it over with. Um, Other side effects has mostly been like swollen hands. I'm having a slight neuropathy, just very slight, and only on my index finger. Very strange. Yeah. So apparently it could happen to like it's just a very strange thing. And then I think a little bit of brain fog, but that tends to fade away after the first week. So I would say, so my chemo regimen is like every 3 weeks. So I would say it's only like bad the first week, and then it's pretty much back to normal the next 2 weeks. I know like some women like love their hair and like, they want it to look like a certain way. I've always been more like, I guess if I cut it and it's ugly, I didn't care too much. Like I would be upset for like a minute and then I'd be like, okay, it's gonna grow back. You'll be fine. So that's kind of like how like my relationship with my hair was. So I was expecting myself to be like just a little bit upset. But when like my hair started falling off, like I started seeing like strands of hair like on my pillow. It was just horrific to see that much hair coming out. Um, I did get a little bit emotional. I was just kind of like I think the emotional part was more so that like oh wow, this is like real. In a sense, I think because I didn't have that much time to process everything, I think just seeing the hair kind of just like hit me in the face a little bit, like, okay, wow, like this is happening. Like kind of just like it just showed me what reality was a bit. So that was kind of like I think that's where it hit the most. And then I felt like I was really concerned about how I looked like without hair. I was like, wasn't sure like if I would still feel attractive or, if my husband would still find me attractive. Like I keep asking him, um, and that kind of thing. But I think, ultimately, like when I shaved my head off, not my head, but my hair off, um, I was, I was kind of surprised that like I thought I still looked good without the hair. And I went on a lot of shopping sprees, just for like new styles and wigs and like makeup stuff. So my next milestone, I guess, is my surgery. So the surgery I'm getting will be a total hysterectomy. So what that means for me is that they are going to be taking out my remaining ovary, my uterus, the fallopian tube that attaches to the ovary, and also my cervix as well. I am incredibly anxious about it, because once they take out that ovary, that puts me in surgical menopause. And for women that are like being in forced menopause, I'm high risk later on for like osteoporosis as well as like heart disease. Not to mention, like, oh, I've been reading a lot of other women's experiences that are around my age, mostly like breast cancer survivors. It sounds like there's like a thing called vaginal atrophy that will happen or might happen as well. So not looking forward to that. Also, all the other stuff that comes with menopause, like hot flashes. So I'm very, very scared about like what's might happen. And also they say that like sometimes you don't like get those symptoms right away. So it's not like I'm gonna wake up and it happens. So it might take like a few weeks before it happens. And so I'm pretty nervous about it. Honestly think what has really gotten me through this is just me on the pole. Because like I'm still able to pole dance and contort, which I don't understand how sometimes. So that has been pretty incredible. Very helpful as well, like for my mental health. I think it's something that I've always used for my mental health, even before, but now I'm really just like really doing it, all the stuff. But I think what shifted in the way I'm thinking about it is to kind of just like appreciate what I can do, versus forcing myself, not forcing, but like going after certain things and being frustrated with it. So I kind of see it in like a new perspective. I look back, I do feel like I had the symptoms. I think I definitely ignored them. I kind of was just like, oh, I mean, I do crazy workouts, so like, yeah, I'm gonna be like, there's some tightness there, or I just kind of brushed it off. But when I look back, I was like, I was kind of in pain. Like it was weird because I was remembering how like, oh, there were days like after I trained and I would be like, wow, like training really like hurt today, like today. And like I really don't want to do this pose because it's like putting a lot of pressure in my like abdomen area and it's really pretty uncomfortable. But I kind of just like brushed it away. And so I think that if I did not get that IUD, I think it would have like got to me eventually, but it would have been probably too late. Um, I just like because I'm like young and healthy, I didn't think of it as anything. My biggest advice is to be really honest with yourself first, like kind of like really checking in, like are you feeling something or not? But like listen to that voice when you're checking in with yourself and then like really kind of do your research a little bit too, before going into the doctor, because I mean, hopefully you have a good doctor, but if you don't, at least you have the knowledge to back up like what you are suspecting. And then like be very assertive as to like what you're asking them for. Like I would say something like, hey, like I have concern with this. Can we do like a scan or something? Instead of like having them lead the way almost. You kind of want to like almost lead the conversation instead. And then also be honest with them as to what you're feeling too. Because I think sometimes people brush away symptoms because they're scared of what it could be. And I think I get that because I think that was me. But it's better to like know what it is and deal with it earlier versus later.